we are discussing now the important topics related for your first week. Okay?
Yes, sir.
Regarding the face.
Yes.
Regarding the face, you should have to study this muscle, orbicularis. Okay? You have to study this muscle, orbicularis. Orbis. Okay? You have to study these two muscles. You have to study the muscle of mastication. You have to study this, the temporalis, okay, frontalis, occipitalis, layers of the scalp, blood supply, nerve supply, okay, extension, muscles attached to it. Then the blood supply, the facial artery, its branches, name of the branches of the facial artery, okay. The facial nerve, its branches, its course, how they exit from which border of the parotid gland, okay, parotid gland and parotid duct, its opening. Then we should have to stress on this. You see the muscles controlling the lids, okay, the extraocular muscles. In big, you see, big models, plastic models, we have model of orbits. So all the 6 muscles of the extraocular group, the optic nerve in that model, okay, the levator palpebrae superioris, okay, lacrimal gland, and the questions related to it, like what is the position of the lacrimal gland, what are its parts, where its ducts open, what is the nerve supply to the parasympathetic supply to the lacrimal gland, like this. Then you should have to, regarding the identification, yes, lacrimal sac, okay, and where in the chapter of nose where this duct, nasolacrimal duct opens, okay, and then regarding the orbit, few bony parts like orbital opening, its margins, roof, floor, medial lateral wall, and the orbit itself, its roof, which bones are responsible for forming it, floor, lateral wall, medial wall, okay, what are its openings, where it leads to, okay, like optic canal, where it goes behind, superior orbital fissure, where it goes, inferior orbital fissure, where it opens below, like this. So after that you should have to know, yes, related to the mandible, the head of the mandible, relation of the neck of the mandible with the maxillary artery, auriculotemporal nerve, the coronoid process, which is structure attached to it, okay, temporomandibular joint, its ligaments, its movements, muscles responsible for each and every movement of the temple, unilateral, bilateral, acting together or acting on one side, okay. You need skull? No. You are in M2, right? Yes. So what do you want? Skull? Just take it and then bring it to me again. Okay. Then the nerves closely related to it. What are the nerves? Name the nerves which are closely related to the mandible. Which nerve goes through the mandibular foramen and its branches, motor branch, sensory branch, all. Okay. The facial artery, its relation with the mandible. Then inside deep to it would be the pterygoid muscles and the soft tissues here in the plastinated bodies, the muscles of mastication, lateral medial pterygoid, temporalis, okay, masseter. You should have to identify these things. Okay, David. Buccinator. Buccinator also important. Yes. Mandible. Yes, that would be completed.
Completed.
So the in the soft tissue body parts, the infratemporal fossa may be asked in relation to the muscles, any muscle of mastication like medial and lateral pterygoid. Where does it present? What are their boundaries? What are their communications? It may be asked. Okay, both for theory and both for practicals. Regarding the if you go towards, yes. Now, if in the hemisections, you should have to identify the nasal cavity, the important structures, the bony nasal cavity, okay, the lateral wall of the nose, how it is made, the concha, the two bones responsible for making the concha, you should have to remember those, and the meatai, the important, now he is coming for another time. I think we all go with you.
Next.
Okay.
What is solid?
Why he is asking about histology?
I have no idea. It's very interesting.
I think he is making some slides
So,
to reveal out bone, compact and spongy bone. Okay? In this model, for example, we have cranial cavity not included, the sinuses, frontal sinus, sphenoid sinus. What is this sinus, by the way? This is sphenoid sinus. What is this?
no, that's not.
This is sphenoid sinus. This is, what is this? If I make an arrow here, you will identify it as sphenoid sinus. If I make an arrow here, what will be the answer? Sphenoid sinus again. This is also sphenoid sinus. Because you see, no, I am not confusing you. Why? Because in the exam, people will think that this is sphenoid.
What is this?
When we put this flat. So you should have to remember these two both are sphenoid, because this is not the place for ethmoid sinuses. Ethmoid sinus lie here, okay, in between frontal and the sphenoid sinus. Okay, so sphenoid sinus. Then you should have to, in this specimen, the joints of the neck is included, cervical vertebra, isn't it? So this may be asked. Previous batch, we asked this bone, atlas, first cervical vertebra, and this is the second cervical vertebra. The body is moving up. This is the odontoid process. Okay, this is axis, second vertebra. Okay, so, and what about, yeah, one time this ligament has also been asked. Top.
No.
Ligamentum nuchae. Okay, ligamentum nuchae. So you should have to remember, because it's very important how it holds up the two vertebrae, what is its action, what muscles are going to attach on it, like this. So this one is also important. Regarding the other features, you see, what is this depression called? This depression, this is the opening for auditory tube opening. Okay,
So we didn't do this.
auditory tube opening. This is superior concus, middle inferior concus. Okay, how the floor of the nasal cavity or the roof of the oral cavity forms. What are the bones responsible for forming this area? Okay. One thing really very, very important, as you can see here in this specimen, the genioglossus is usually been asked. many times. The genioglossus muscle.
So genioglossus is included in the oral cavity, right?
Yes.
We don't have the oral cavity this also.
Okay, you don't have?
No. We don't have the oral cavity, pharynx, larynx, right?
Pharynx, larynx not
Oral
included.
cavity. And ear is
Okay.
not included.
Ear is also not
Not
included. Leave it. Okay. Now you should have to see this one. This is included in the triangles.
Yeah,
You did the
yeah.
anterior triangle.
Yeah, we have that.
So
And this
this is mylohyoid.
milo.
Forming this mylohyoid. Okay.
Yes, forming the base.
Yes, base of the floor of the mouth. Okay. Now this the arterial supply of the lateral wall, the septum, nasal septum, the nerve supply of the lateral wall, the septum. Okay, included. Now you should have to go on this side. Parotid gland with that, the facial nerve, masseter, these important muscles, and auriculotemporal nerve. What is this muscle called? Sternocleidomastoid. What is this muscle called?
Which one?
Occipital belly of what? Yes. What is this?
Not just
You are the cameraman? Occipital of what? He is running the studio. Trapezius. Trapezius. The most prominent, most external in the neck, two muscles. One is on the back, other is on the lateral side. Okay? Trapezius and sternocleidomastoid. Okay? Regarding the neck, you see here this is almost very much superior. More inferior to it would be the carotid sheath may be asked. Okay? You can make a black or whatever colored circle around the common carotid and the interjugular vein, vagus nerve. So with ill-defined boundaries, we make it like a colorful circle. So this would be identified as carotid sheath. Okay? Usually the students, they may not identify it like this. Submandibular gland. Okay? This muscle. Posterior belly of digastric. This is stylohyoid. Okay? This is the anterior belly of digastric. What is this? Oral cavity is not included.
No.
Finish. So related to the identification and the blood vessels also, from where it is coming, maxillary and the superficial maxillary and the superficial temporal. Okay. Then okay. Like this.
What about the ligaments of the nose? Cartilage of the nose? Major alar, minor alar.
May be asked, but usually
Not.
we didn't ask previously.
So we can get stopped.
You can leave it. Regarding the mandible, very, very important this area, the nerve, inferior alveolar nerve, okay, where it is going and what is its course before entering into this canal, which motor nerve is coming out from it. Okay, so this area very important, related to the attachment of four muscles. Okay, superior, inferior, genial, tubercle. Okay. Now, after opening it, we can ask you to know. No, this nerve is not present. Inside there is yellow colored inferior alveolar.
On the other
We may
side.
ask this side also. Yeah, inferior alveolar. Okay. And the temporomandibular joint, all totally important. Its ligaments, its type, its functions, actions, nerve supply, all. Okay. Regarding this bony skull, you should have to identify these things. This is very important area. Thyroid plate. This very important area. Styloid process. This is very important area. किसकी? हाँ, फार्मेसी की मैं
आज 2 क्लासेस है, एक आपकी एक मेरी। सर ने मुझे कहा है कि मैं पहले पीटी।
Okay, now these would be important pterygoid plates. Okay, dear. We were discussing styloid process, mastoid process, the condyles important foramina, foramen ovale, jugular foramen, and optic canal, superior orbital fissure. Okay. And this carotid canal, these foramina are important. Okay. So in this skull you should have to identify also related to the sutures, lambdoid suture, bregma, anterior fontanelle, posterior fontanelle, their closures, terion, its importance inside, all. And regarding this nasal cavity, you should have to remember the walls of the nasal cavity, how they are formed, which bones are responsible for making it. Okay. Regarding the these things are important, which are usually being asked. And next, identification of few structures in the proximity. Most important structures related to the ospit. Okay. This muscle, very important. Sternocleidomastoid muscle. Okay. Sternal head, and the clavicular head is this one. Okay.
So they will ask this like this muscle
Because the total sternocleidomastoid is not present.
So they will ask just this
They
part.
can ask, yes, of course.
Okay, just tag this. Okay.
They can tag here. So sternocleidomastoid. This vessel. Okay, identify this vessel. Okay. These muscles.
This is
Sternohyoid.
sternocleidomastoid muscle.
Okay. What is this muscle?
Is
Omohyoid. Okay. Okay. What is this muscle? Scalenus anterior. Okay. Okay, fine. So we should have to go like this. Larynx not included. Pharynx not included. Oral cavity not included. Ear not included. Okay. In this, it may be asked, what is this? Inferior oblique muscle. Okay. What is this one? Superior rectus. Very good. Okay. What is this? Lacrimal sac. Okay. What is this? Superior oblique. What is this? Just see. Lacrimal gland. Lacrimal gland. What is this?
Frontal sinus.
Frontal air sinus. Very good. What is this? What is this?
So can they ask what is this?
No. Not included.
Right.
So they should just ask what is this brain.
Orbicularis circular. Okay. What is this? Masseter. What is this? Maxillary artery. Okay. Okay. What is this? Inferior alveolar branch of the maxillary from the first part of the maxillary artery. Okay. What is this nerve? Inferior alveolar nerve. What is this? Lingual. Okay, what is this? Lateral pterygoid. What is this? Medial pterygoid. What is this? You people are answering very fluently, but what you people are doing in hospital? Very strange to see so many mistakes.
Stress.
In stress, why? No need to be panicked.
So we see doctors immediately get stressed.
No, because you are seeing all of us all the time for the last 2 years.
1 minute, move.
Huh? No, be relaxed. Today in the morning, the boys were doing mistakes on this
Online
online
they just
examination.
don't
They know the thing. They are repeatedly doing all the things, but committing mistakes. I don't know why.
No, cashless work.
Hmm?
No, nothing.
Now, what is the structure? Duct, parotid duct. Okay.
That's about it.
Can you rotate this side? Back muscles not included. This is you have done in first
Yeah,
year.
first year.
First year you did it. Okay. The other, yes. What is this? Auriculotemporal nerve. Okay. So you know auriculotemporal, but in this you may be confused. What
the thing is the 1 minute time span shortens.
Yes, that's the problem. That is the problem.
Yes.
Okay. What do you call it? This one? Which carotid?
Common carotid.
Common carotid. Okay. What is this?
Vegas.
Vagus nerve. Okay. Where is internal jugular vein? Where it could be? Not found?
Someone removed.
Someone has eaten it. What is this? Inside. No. This one.
What is it?
Submandibular gland. Okay. Now turn towards opposite side.
Opposite?
Yes. To see the nasal cavity. Yes. What is this? Sphenoid sinus.
Both of them.
Okay. What is this? Inferior concha. From where it arises? From where inferior concha arises?
See, that's the kind of question we get a mistake.
Yes.
In the hospital.
From?
It's a different bone.
It's a separate bone.
Separate bone.
It's an individual bone. It is not coming from anywhere. It's a separate bone.
Okay.
So inferior concha. Okay. So you should know the lateral wall of nose,
Yeah.
arterial supply, nerve drainage, and the openings in the lateral wall, very, very important. All. Okay. Then you should have to identify this.
Atlas.
Atlas. What is this?
Access.
Axis. Okay. This is not included.
Wasn't the nerves?
Which nerves?
This one here, the opening? The opening of the nose?
No. You should have to know about the nerve supply to the lateral wall and to the septum. Okay. You are talking about this?
No, I mean the opening.
What it could be?
Palatine or sphenopalatine. What?
What is this?
The palatine nerve.
Yes, the palatine nerve divides into two, greater and the lesser palatine. Okay. Okay, I think in this body these questions may be asked. Okay. And for the ligamentum nuchae, the pointer should be here. It should be placed here on the top. Because if you go down, then that would not be ligamentum nuchae. That should be interspinous ligament. Okay? So the supraspinous, interspinous ligament, and top of it would be ligamentum nuchae. Okay? Any question which you want to discuss?